welcome to In Good Shape. They say beauty lies in the eyes of the beholder. Taking this quite literally, what happens when you can't see? For example, if you're threatened by a retinal detachment. We'll tell you more about what this is and the warning signs. But first, here's what else is coming up in the program. Varicose veins, not just unsightly, but possibly risky for the health. No time for the gym, fitness devices you can use at home. And it's a matter of taste, why the flavor of food changes as we age. The retina is a thin layer of clear tissue at the back of the eye, which transmits images to the brain through the optic nerve. Any damage to the retina, like a hole or a tear, affects our vision. In extreme cases, the retina peels away entirely from the underlying support tissue, a disorder known as retinal detachment. Unless this condition is treated immediately, it can lead to blindness. So if you suddenly notice flashing lights, spots in front of your eyes, or have blurred vision, go to your doctor right away.
The eyes are our window to the world, helping us orient ourselves and anticipate obstacles and danger. Our eyes deliver 80% of the information we receive about the world around us. But what if our vision deteriorates? Martin Kronebach nearly lost his eyesight when he suffered a sudden retinal detachment.
When I closed my eyes, I saw flashes of light, and they continued when I opened my eyes. It got worse throughout the day, until I started seeing objects drifting through my vision. There were little black dots, a gray fog, and what looked like little worms wandering around, and I couldn't make any sense of it.
Ignoring these signs of retinal detachment can be fatal for your eyesight. You should see an eye doctor straight away. It's a common occurrence that can affect anyone. But what actually happens when the retina detaches? The eye is filled with a gel called vitreous. It adheres to the lens at the front of the eye and the retina at the back. Nearsighted people, diabetics, or those who have had cataract surgery are especially at risk. In these cases, the gel can tug at the retina until it breaks. Should that happen, it's critical to get immediate medical attention. The sensory cells for vision can die off within hours. 35-year-old Martin is short-sighted and therefore a risk patient. Luckily, he got to the hospital just in time. The retina is still intact. Minimal invasive laser treatment is still possible.
Laser treatment is less stressful for the patient since we can treat the tear on an outpatient basis with a slit lamp and local anesthetic.
The doctor aims the laser at the healthy tissue around the tear and tacks the retina back in place. It's a cauterization process that reconnects the retina to the back of the eye. The patient remains conscious throughout the procedure.
I didn't count how many stitches it was in the end. It was painful, of course, but I stuck it out and got through it because I wanted to keep my eyesight.
But in more severe cases, where a large area of the retina has detached, laser treatment is not sufficient. Such was the case for Konrad Sedelmeier.
He has retinal detachment with 2 holes in the retina and a lot of lattice degeneration. We need to operate.
It's a few hours after Konrad's eye operation. His procedure required general anesthesia, so he didn't feel a thing. Scleral buccal surgery is another option. The damaged tissue is treated with freezing therapy, and the outer eyeball, or sclera, is pushed towards the retina until it's reattached, creating a dent. The doctor keeps the dent in place with a seal or silicone band sewn onto the eyeball. These are seldom removed. But that's not a problem for Konrad.
I came through it all right and have no problems with my right eye. I can't feel the band they put around it. The doctors say it'll be healed in 2 weeks.
The retina can still tear after an operation, but the chances of recovery are good when it's dealt with in time.
A simple way to check your vision is the Amsler grid test. It's really easy to use. Close one eye and focus on the graph like the one you see here. Do any of the lines look wavy, blurred or distorted? If yes, you may have a problem. We've put the graph as well as other details on our website for you. That's dw.de/ingoodshape. Remember, early diagnosis means early treatment. Now, if you spend a large part of your day standing or sitting, perhaps you know the feeling. By the evening, your feet are swollen and your legs feel like lead. It's possible that you have varicose veins.
The superficial leg veins lie just under the skin. They collect blood, which is transported to the deeper leg veins, seen here on the left. Valves in the veins make sure that the blood can flow against gravity and back to the heart. Leg muscles help the deep veins to push the blood upwards. Varicose veins occur when the connective tissues of the superficial veins weaken and no longer close properly. The blood collects in the veins and causes them to steadily expand. As the pressure builds, liquid from the blood escapes into the surrounding tissue. Varicose veins can also be caused by blood clots, which block the blood flow to deep veins. Blood then pools in the superficial veins and they enlarge and wear out. In this case, the problem begins deep in the leg.
I'm now joined in the studio by Dr. Ingo Flessenkemper, a vascular specialist in Berlin. Dr. Flessenkemper, welcome to the show. How common is this condition of varicose veins?
Oh, it's very common. I think about 8% of the whole population are conflicted by this disease. It's a kind of disease. And so, for instance, in Germany, we have between 5 and 8 million people who have varicose veins.
Now, is this disorder or disease confined to older people?
Yeah, sure. If you get older, it's more probable that you are conflicted by this point. But even young people can have it.
So what are the symptoms of this disorder? We have one viewer who's written in from Namibia, Matthias Asino. He asks, is a burning or a tingling sensation in the leg a symptom that he has varicose veins?
Oh, indeed, not really. Burning is not really a sign for varicose veins. Yeah, I think it's more a swelling, it's a dumb feeling that you're just in the afternoon or in the evening you have heavy feet, heavy legs, and that's a typical symptom.
So how does one actually know that you have varicose veins? Why do some people have it and some people don't?
Oh, a part of varicose veins are transmitted from one generation to the other. So it's a part is genetic, but the other part, I have to say, is just as a consequence of the Western lifestyle.
I see. Now, we'll talk more about the lifestyle later, but how does someone know that the problem that they have is serious and they actually need medical intervention?
Oh, I think if there are varicose veins, you really should go to your doctor to test it, because there are some conditions that can damage by varicose veins the deep venous system. And if there's something wrong, we cannot repair anymore.
And at what point do you actually recommend surgical intervention?
Oh, if there are, for instance, symptoms, it's always a point that you should treat them. And by which method, of conservatively, or if it has to be treated by